I believe, and I think you will agree, that the community and the hospital have created a dynamic relationship. We cannot exist without each other. The community is depending on the hospital to stay present and vibrant, and for the hospital to do that, we need your support as a community.
Well, what brought me in, I had to go for a nuclear stress test in Dr. Alvarez's office. And unbeknownst to all of us, I'm allergic to that dye. So I had a terrible reaction the next day. And I called the staff, and the staff is so compassionate and they're so responsive. And they said, go right over to the hospital. And of course, because I live across the street, I just drove my golf cart over. And Dr. Alvarez called me. And we talked while I was going into the emergency room, and she said, well, we're going to do a cardiac catheterization and make sure everything's okay. Everything came out fine, and I was very pleased. You know, Dr. Alvarez exudes confidence. When she was talking to me on the phone and telling me that we're going to need this right away, you sense that she knows what she's doing, and you feel very comfortable. You're not that nervous. You know, so it was a great experience, and we had it done and it was fine, and I was home by 6 o'clock.
It's important to expand cardiac services because our community is expanding. And a big portion of that is the technology and also feasibility of care and continuum of care. So presently, our cardiac services is sort of divided on different floors and different areas of the hospital. It'd be wonderful for our patients to be able to be cared for right in the same area for the continuum of care, and also for our doctors and staff and all of our customers to be able to be in the same environment and work along the modalities in the same environment. In addition to that is privacy and also innovation. So how do you have privacy and innovation? Well, we need privacy because we need to have separated rooms, you know, where we could offer a larger area so patients can have their family members with them or their loved ones with them, their friends with them, which right now we have pretty tight quarters. So it's a little challenging. And then in addition to that, new equipment and technology to be able to go with what's offered for cardiac services throughout the country. And so those are the reasons for the expansion.
We live in a vibrant community that continues to grow, and the individuals that live in this community are at that age where most of them are going to need at some time some type of cardiovascular service. So this is where mom is going to come to receive her care. This is when your sister and your brothers are going to come to receive the care. So this expansion not only is going to allow for more individuals to receive the benefit of an excellent cardiovascular service, but also is going to be all localized in the same place where you can have your cardio diagnostic. You can have, if your family member is coming here for a heart cath or is coming here for a pacemaker, and allowing not only everything to be organized in the same area, but also the privacy that the patient deserves and the accessibility of the family members, so they can be at bedside at the time when the family members are more vulnerable. So not only are we offering an opportunity to have the best quality service, but also is all in the same place where the patients feel safe, their family member can be there, and we can provide that excellent care.
I cannot thank our community partners enough for the impact of their gift on every life that we save.
In closing, I'd like to thank you on behalf of the Foundation for all the support you have provided since March of 2013, the inception of our foundation. Because of your support, our businesses, which consist of the Hospital Gift Gallery, Hospital Cafe, and Thrift Shop, continue to increase revenue. Our scholarship program has reached over 100 students. Our endowment fund exceeds $400,000, and the room naming program has over 100 sponsors. Because of this, we've been able to provide over $10 million to the hospital. Now we embark on a new campaign to fund the Philips scanner. Please join us in this new adventure. Our goal is to raise $1.4 million. Thank you for your continued support.